Welcome to Get Moving TV. I'm Dr. Chris Landon. I serve as your host. This is kind of a bittersweet moment here after 2 decades of Get Moving TV. This is the last episode. We have remarkable things that occur in Ventura County from, as you've seen, from movie making, monster making, medical things that we bring here, art, music, movies. But what's most important to me is a pediatric pulmonologist, pediatrician, parent, and resident of Ojai, is when my director of fund giving, fundraising, Amy Towner, came to me and said, "Oh, we need to have 2 new intracranial pressure monitors because of all the head trauma from e-bike injuries." So today, very kindly, we're joined by Dr. Thomas Duncan, head of the trauma service at Ventura County.
Well, thank you very much, Dr. Landon. I really appreciate you bringing me on board to be on the last show.
Well, one of the things you've done, you've been so involved in preventing trauma. You'll go to high schools. What kind of things will you tell the high schools? Separate from e-bikes, you've been at this for a long time.
Well, we go to high schools to do a course called Stop the Bleed. And Stop the Bleed is a course that was generated by the American College of Surgeons back in 2016. It was in regard to the Boston bombing and then the Sandy Hook event. So the Obama administration charged the American College of Surgeons to bring a group together to talk about Stop the Bleed, how to stop preventable bleeding, which is bleeding that can cause people from dying. And hemorrhage is the #1 cause of death from trauma. As such, we do the Stop the Bleed course. We teach people how to use tourniquets, how to pack wounds, how to prevent that bleeding that will cause them to die. And as such, we've incorporated this into our junior lifeguards. And we're now an annual event at the junior lifeguards where we teach 300 kids every summer how to stop life-threatening bleeding. And it's something they can take wherever they go in the world. It's a tool they can have in their tool bag. And it's just like knowing how to do CPR. Wherever you go in the world, people bleed the same. They bleed red blood. The blood isn't different. So it doesn't make a difference where you are in the world. You can help save a life.
Well, I've always been impressed. I think it was in Seattle where to get a driver's license, you had to know CPR. Because in the hospital, on TV, oh my gosh, we can save everybody's life with CPR. And really maybe 1 out of 10, you're gonna recover. But if you're right there on the scene and get things going right away, as with the Stop the Bleed. So, and then in terms of the trauma service, how long has the trauma service been around? Because I think that's the last time you were here. We're just
Correct.
initiating it.
We were designated by the EMS service in 2010. And then in 2011, we were given a verification by the American College of Surgeons. So we were given the stamp of approval. And we've been verified every 3 years since then. And so we've been going for about 15 years. But even prior to that, we were doing trauma. It wasn't organized, but now we're a well-oiled machine.
Well, I think I like numbers and the like, and I think one thing that really pops out is just the quality of care. Have you had any meritorious citations for the quality of care here in Ventura County?
We have, particularly with the surgical group, there's something called NSQIP, so NSQIP, the National Surgical Quality Improvement Program. That program looks at all the numbers in terms of the surgical patients we take care of. They look at the outcomes, they look at the morbidity and mortality, and we've been given the award for 8 years running. And this award is given to centers like the Mayo Clinic and other high-performing centers in the nation. And so we're among that group, even though we're a small center in Ventura County. So we're really proud of that, and it's something that we take to heart and do a good job and try to keep it going every year.
Yeah, you've been an incredible leader, calm, but making certain that everybody steps up to the mark there. Yeah, it is Ventura County is interesting that we've got the ocean on one side, the mountains on the other, and if dolphins and bears had more trauma, you'd be even busier. Is there air support? Is there helicopters that can go out for trauma?
Yes, there is. There's an air squad that goes out and picks people up and brings them to our center. We have a landing pad, and actually the landing pad can now accommodate a Black Hawk helicopters. And in the past, we never used to be able to accommodate them, but it was retrofitted to make happen about 2 years ago.
So I think someone got bit by a rattlesnake the other day, and and they come by helicopter. They fall in the mountains out in Ojai, and they come by helicopter. But the Highway 126 used to be, I think, one of the more dangerous highways on the. So how's that been? Is the
It's
120?
not changed. I know it used to be known as the Death Valley,
Yeah.
but that's changed. Though we still have patients come in from the 126, and some of them are really badly injured. I mean, in the past, when we started our trauma center, we used to admit patients with a total number of about 1,000 patients per year. Now we're up to over 2,000. So over 100% increase in the number of patients that we see over the course of the past 16 years.
It's not just the surgeons, no disrespect, but tell me about the whole team of that goes into trauma. Where does it starts? Where
Of
does it
course,
start?
it starts in the field with the EMS, and we cannot do it without them. They do such a great job. I was in a meeting earlier today with the EMS, and we always want to give them the utmost respect that they deserve. So it starts with the EMS, and then when the patients come to the hospital, we start in the emergency department as a team, similar to being at a NASCAR. So it's organized chaos. We have the nurses, the respiratory therapists, the CT scan techs, the X-ray techs, the surgeons, including the residents that show up. And then we have the nurses, we have the social workers. So it's a big group of people that show up, and it's a lot of resources. That's why it costs so much to take care of trauma patients. But like I said, it's organized chaos. Everyone knows their position and their duties, and they do a great job, because the more you do, the better you are skilled at it, and the more your outcomes are improved.
Who's the captain of the ship during that?
The captain of the ship is generally the surgeon on call, the trauma surgeon on call, and he or she directs the way things go. And they stand at the foot of the bed and have their bird's eye view of the entire process. And so it's not looking at the trees in the forest, but looking at the forest and ensuring that things go well.
Yeah, some people can't tell the forest from the trees, or forget the common uses of wood. How about the training that it takes? Is there specialized training then for in trauma? Do the residents have to go through trauma training?
Generally, the residents go through a 5-year residency. Sometimes it could be up to 6 or 7 years based on whether they do an extra year or two of research. And if they want to go into trauma particularly, then they do a year or two of trauma fellowship. Now, there's some surgeons that have done trauma for so long that it's ingrained in them, and they haven't necessarily done a fellowship, but they've done it so long that they know how to do it well. And those individuals are grandfathered, quote unquote, into that specialty. And they also do general surgery along the way. So it's a big team. We have 11 surgeons, 10 of us take trauma call off and on. And so it's one way of keeping people in line, especially as there's somebody that needs to direct them. I'm the trauma medical director, and I look at all the surgeons. I look at report cards. We get report cards every year, and we determine who's making the cut, who's not making the cut. We have to respond to the highest level of trauma patients by 80%. Within 15 minutes of when they arrive, we have to be there. So if you aren't at 80%, then you get a big ding from the American College of Surgeons, and we function at 95%. So we're doing well at that, and it's always a badge of honor to recognize the fact that we all are on the same page.
And we have the golden hour when we think about.
Yes, the golden hour of trauma, or the first 60 minutes of trauma, where if you don't do things correctly, then the patient could die. And so it's a teaching taught by the Advanced Trauma Life Support, or ATLS.
And how about, so do nurses go through special training? The residents themselves go through, not the family medicine residents?
There's a course called the Advanced Trauma Life Support course, the ATLS I just referred to. They have to go through that course, and it's offered to the first-year residents within a few months of when they arrive at the VCMC. And that course is refreshed every 4 years. So within that course, they learn how to take care of patients within the same golden hour when they can potentially die. And this course is offered all over the world. So regardless of whatever language you speak the same trauma language, and that way there's no confusion of how to take care of patients. The nurses also take what's called TNCC, the Trauma Nurse Qualification or course, and that way they are also in tune as to what we're looking for when patients come in. Put in the large IVs and then ensure that the patients aren't bleeding, control the bleeding, get them to the next step. So it's a course that actually was recently held last week at VCMC.
We are a center of education, not just for the residents, but really for the whole medical community. And our residents now are on global health, and so a number of them are heading out. And the number of resources that are available, they don't have jaws of life in the jungle in Honduras. There, it takes 3-4 hours to get someone out of a car wreck. So they have to learn different ways, different approaches. Well,
Correct.
where we started re-interacting, I guess, is around e-bikes, because I was talking earlier, we've got to raise more money for the intracranial pressure monitors. So what's happened in Ventura County, say, over the last 5 years or so in terms of bicycle accidents? Because that's really the e-bike craze. One of my patients who was in a car accident, he had cystic fibrosis, broke his neck, and his make-a-wish was an e-bike. I go, no. So what's happened? What have you seen from the e-bike perspective?
E-bikes have taken the nation as a big craze. It's a new thing on the market, and most teenagers want to get it, and even older adults want to get e-bikes because it's easier to get up a hill and then keep moving. But as far as the numbers go at VCMC in particular, in 2023 we saw a total number, say 34 injuries from e-bikes, and then 2024 35, and then 2025 went up to 84. So it skyrocketed. And then the pediatric population, initially in 2023 we saw about 14 e-bike injuries, and then 2023, then 2024 we saw 7. So the numbers dipped, and then 2025 we saw 37, so more than 6 times the amount of injuries. Now, not all of these individuals had those kind of injuries that could cause them to require the intracranial monitor, but they had significant injuries. I mean, the other day I took care of somebody that had an injury to their scapula, which is the bone in the back. They had bruising of the lungs. They had an injury to their liver, an injury to their kidney, pelvic fracture, and it just kept going on and on and on. So these are individuals that could have potentially prevented having that injury. At least 35% have on helmets, but the rest don't have on helmets. And when they have on helmets, most of the time, it's bicycle helmets. And those bicycle helmets are normally made to withstand injuries of those going about 20 miles an hour. But once you get over 20 miles an hour, it doesn't work as well. So they require a full face helmet, and that potentially can do the job. But there are no laws about that.
I know Dr. Starr was showing me a picture of someone with a horrible knee injury, but her head was fine because her dad was a motocross racer, I guess, and she had a motocross helmet on, so proper protection. And then,
Correct.
of course, the passenger, too. I mean, now we've got girls out there on e-bikes with 2 or 3 girls on an e-bike, and they all fall off at the same time. I'm sitting out in my car out in front of Nordoff High School and watch all the e-bikes come out, and I'm looking for a helmet on any of those kids. So just the numbers are going to do it.
Yeah, the big craze is doing wheelies on it.
Yeah, well, and while you're holding your cell phone.
Correct.
And being chased by a police car. You really want to get all that on there.
And the worst part is some of these e-bikes, I mean, they're supposed to go, say, 20 miles an hour for class 1 and class 2, and then class 3 is 28 miles an hour. But you can chain them around. You can chain them around in such a way that they can go up to 70 miles an hour if you have the appropriate device to switch them around. And that gets really dangerous, especially if you don't have a helmet. It's essentially a motorcycle that you're riding.
Yeah, that's it. So American College of Surgeons has been very active throughout the world in terms of stopping the bleed and everything else. What's happening at that level? I mean, they're seeing it. Every surgeon in the United States is seeing this increase in e-bike injury. Have they taken
Correct.
on as a college?
They have a position statement, which I was a part of putting together, I mean, with several other surgeons, and we put together that statement about e-bikes and the dangers of e-bike, the data that goes along with it. And the fact that each different state needs to make some laws changed in terms of helmet use, research, and the ability to curtail these injuries because they're preventable. And if it's preventable, then we're all for it.
Well, the statistics I saw, Grill Diaz, who's your goddess of statistics and everything else in my book, was showing me that there's these two peaks, 12 to 17-year-old males, and then males over the age of 41 who think they're 12 to 17 years old, and that they've gone from 1 out of 4 EMS calls being bicycle related to 1 out of 3 being related. The trend doesn't look good without change. How are we going to change it here in Ventura County? Are we working locally or working with the state assembly? So it's not just a national problem, but what can we do
No,
here?
it's all over the nation, but locally we're working together with the public health department and also with our local legislators, particularly Assembly Member Steve Bennett. I met with him the other day, and he's on board in terms of trying to get things changed in Ventura County, and hopefully we can get some helmet laws to help. We don't necessarily want to take the bikes away from anyone because that's not the intent. The intent is to ride safely, and that's what we're all about. It's all about making sure we keep those individuals safe.
Yeah, if we have a $1,500 bicycle, a $200 helmet shouldn't be that far behind. How are we going to help the parents? Well, having watched my skateboarders and every other sport that teenagers go through and break things, they leave the house with a helmet and then gets tossed in the bushes because they want to be cool. But there's some cool kid who is wearing a helmet while he's skateboarding. Now everybody needs to have a helmet to be cool if they're a skateboarder.
Correct.
How can we help that to happen?
Yeah, it's all about education and publicity. So once you can get a cool kid who has one on, or if you have somebody that had an injury, a terrible injury, and is willing to go to the media to speak about it, to speak about the injury they had at the board of supervisors or the city council meetings, and relay their story from beginning to end. It is so impactful. Stories go a long way, and I learned that through the American College of Surgeons. And we can talk all we want to about the fact that we want data to be accrued, we want some laws to be instituted, but when you have stories to tell, when you have patients that show up and tell their struggles that they went through healing, that goes a long way and speaks volumes.
And we have Dr. Goldie, who was our neurologist, and I was the pulmonologist at the time. We had a young man who got a bicycle at Christmas, 8 years old, went down the driveway, got hit by a car, ended up on a vent for a prolonged period of time. And he would be a perfect example of someone. We ended up making movies with him where he'd play Rocky or Wilson. So he'd be, but trying to make a life for himself is really the big difficulty. Well, we've talked about bicycle riders. When I'm on the trail in Ojai and some kid comes by going 35 miles an hour and knocks my hat off, how are we going to protect the passengers? Do you see? Can we do this city by city, or can we have a county-wide ordinance?
I think it's a combination county-wide and then city-wide, but having separate lanes, and it's going to be expensive, obviously, but you can take the cost of a life and look at that, and the cost of making things safe in the county, and say, well, hey, geez, we need to do something about it, because you cannot bring back a life. Once a life is gone, the life is gone forever, and no matter how much you want to spend on it, that life isn't coming back. So I think making some ordinance changes in the city of Ventura, making safe lanes, and I think they're doing it in San Diego, so we can look at that as a model.
But Cal State Long Beach, we were talking earlier, is no e-bikes on campus. We had death at Stanford from bicycle versus pedestrian. At UC Davis, 50 years ago when I was in college, that was their major source of trauma, was just bicycles ridden at 8 to 12 miles an hour, but hitting pedestrians or hitting each other. So where do you see this going? How can we help as a community? Rotary, Kiwanis, Seroptimists, or back to the schools?
I think it's going to take a combination of forces in terms of, like you mentioned, the Rotary, The parents need to be at the table, the local school boards and the trauma center, the board of supervisors. It's going to take a village to make it happen.
I just when we're talking about Highway 126 being a major sort of, if you want to cross the River Styx, take the Highway 126. And at one point, a while back, we had the highway patrol would stop you if you were going the speed limit and you got a free pizza. So catching people being good with their helmets on rather than just penalizing the people who don't have the helmet on sometimes is a way to go. Then trying to get that cool kid wearing a cool helmet with a cool decal on it. I'm not cool. I'm too old to be cool, unfortunately. So yeah, we've got to search somebody out. Where do you see trauma centers going in general? Are they properly funded? I mean, we're going to pay for an Iran war. We're going to start seeing. It's an expensive process.
That's always a big conversation at our conferences about trauma research and funding. We aren't getting as much funding as the cardiologists do for heart attacks or myocardial infarctions, and we certainly don't get enough funding like the centers do for cancer care. So trauma has a big burden of disease, and it's not recognized as one. It's not recognized as a public health problem, but it is, because all over the world we have trauma, and if you don't take care of that aspect of it with adequate funding, then you have more deaths that occur. There's higher morbidity, and there's mortality, and those individuals that could potentially be in the workforce end up not being in the workforce because they get injured as a young individual in the 20s, 30s, and if you don't have enough care to take care of them or the resources, then they're out of work for the rest of their lives. And obviously, if you're young and healthy and injured and you want to get back to work, but you cannot because you didn't have enough care to do it, then it's a game changer.
Well, I was talking with Dr. Castell from the Public Health Department. I guess there was a summit of the police, and I don't know if you were there. Public Health was there, trying to come a year ago. What are we going to do? And what she was telling me is they really didn't come to a conclusion of what to do. They have a website which has a nice YouTube video with the sheriff just talking about what they see out on the street and the statistics and so forth. So hopefully we'll be getting a grant from the American Academy of Pediatrics just on how to do this and work. How do we work with the schools? How do we work with Rotary? And to be a model by expanding throughout Ventura County, because it's not just Ventura is everything. Ojai to me is everything, and Camarillo, a lot of bicycle on the sidewalk. But I've got Simi and Moore Park and Somis and all these places, all of whom are going to need to have someone come to their board of or their little city council meetings.
Correct.
To start working on it. And that's where I look for a model across the United States. If there's, Milwaukee's got it figured out. Orange County is, there's a doctor down there who's been at it for a while, and she's not competing with me for the grant. She has another piece of it. But how do we educate the public? How do we catch people being good?
Yeah, the public health department in terms of the website is great. I mean, it shows that the numbers are going from 9.8% over the past 5 years to now 41% as far as e-bike injuries, which is significant. But in terms of those that are doing it well, those that have figured it out to a certain extent, I think San Diego has done that. And so we can model after them and try to use what they've already determined and go from there.
Okay, well, that sounds like exactly the right approach. Regionally, are we the only trauma center in the Central Coast? Are there other trauma centers up and down the?
No, there are other trauma centers. In Ventura County, there are 2 trauma centers. There's one in the East County, which is Los Robles, and then we're in the West County, and both are adult level 2 trauma centers. Though we see pediatric patients, and we take care of them well. If they have injuries that require transferring them out, then we transfer them to Children's Hospital. There's Santa Barbara Cottage Hospital is another trauma center. Then we've got Marion Medical Center, and so there are a couple of those trauma centers up north. But in Ventura County in general, we are the West Coast, and then Los Robles, the East Coast Trauma Center.
It all seem to be centered along the Highway 101.
Correct. Strategically.
All right. Well, in terms of the surgical practices at Ventura County Medical Center, what are the other specialties that are available there?
There are many specialties, and they fall under currently Anacapa Surgical Associates. So we have pediatric surgery, we have general surgery, we have thoracic surgery or chest surgery, we have plastic surgery, we have neurosurgery, we also have bariatric surgery, so obesity surgery, and and then urology,
And ear, nose, and throat.
and ear, nose, and throat, exactly.
And
So
then,
there are multiple specialties that we see.
And then, of course, I see posters as I walk in. Oh, if you recognize what this is, time for your colonoscopy. So,
Correct.
I know,
Colon and rectal surgery, and so there's
know
a poster about cassettes. If you recognize a cassette, then it's time for a colonoscopy. In the past, it used to be age 50 when you needed a colonoscopy, and now the data has changed. Now it's down to 45, based on the fact that we're seeing more younger patients with colon cancer. Yeah. So that's all changed.
It's all those barbecues. I don't know quite what's bringing about, but well, Tom, Dr. Duncan, thank you so much for joining us for the second time in every 15 years or so. And actually, this is the last show, so it's been very much a pleasure to have you here, and the leadership that you've brought to Ventura County, both with the trauma center, e-bikes, Stop the Bleed, and it really has impact throughout the world, especially as our family medicine residents. And I've trained over 600 of them now over the years as they head out in the community and the world. So Ventura County, it's time for you to put your helmet on. You can get moving, but stop at stop signs, mind traffic, and no wheelies in front of police cars. It's time for you to get moving.